And I share the iCloud drive.
No. So wherever your slides
Share the
open, you
screen.
just need to share your
Share the
screen.
screen.
It's
then you
on
find the
Google.
right. Just says share screen. On the
Share.
options, yeah.
Share. It just has a share button. It doesn't say share screen. Oh,
What option
screen.
did
I
you
got it. Screen.
Yeah, good. And then you may have to move to the right screen. If you have more than one screen open, you may have to move to the right screen that shows what you want to show.
There isn't anything that's allowing me to share another screen. Oh, she's gone to the bathroom. Screen. Start broadcasting.
Yeah. No broadcasting.
Then.
Oh yeah, you are sharing it.
Okay, now hopefully double click the one that you want to show.
Everything's gone blank on my side.
I think it's broadcasting, but it's a Zoom. So just do this, the stop broadcasting. Okay.
Stop broadcasting.
Yep.
So once you share screen, you should see options and say the screen. And then when you say screen, you see 4 or 5 windows open, which one of which is the one you want.
It doesn't. No, it doesn't show 4 or 5 windows.
What does it show when you say screen?
When I share and I press screen, I go blurred, and it just says everything on your screen, including notification, will be recorded. Do not disturb to prevent unexpected notifications. And it shows a Zoom sign, and it says screen broadcast and start broadcast.
Got it. Okay, I'm not. Sura, let me send it to you. Maybe you can share it for her. Let me.
Yeah, sure. Okay. Or let me. Yeah, if you can either WhatsApp me or you can email it to me, and then I will start sharing.
Yeah. Because I've got my hand. I'm still at work, unfortunately. I was gonna be home.
Yeah, so I can share it with him from the Google Drive.
Okay.
Yeah,
share
you can share it.
with
Yeah.
me.
Go ahead.
Yep.
Google Drive. Okay, so I've opened it. Share and export. I'll just share it with you, right? I'll just put your name there. So, and it's slakani09@gmail.
Yes.
Okay. All right. I sent it.
You sent it. Okay. Let me open my Gmail and download it.
Thank you. Sorry about this, everyone. I'm not the best at technology.
No worries. Okay. It is in your outbox, or it is already been gone, or you just shared with me a link?
Yeah, I just shared the whole thing with you.
Okay, yeah, now I got it.
Okay.
Okay, let me just
open
and download it.
Would you have to change the slides for me? Hi, come here. I was trying to share my screen on here. Like I've got when you go to here, share, and then screen, and then why isn't it coming as screen?
Now it is.
Where?
Your screen's on. You can see your screen.
But where's this thing?
They're seeing it. Ask them.
Is anybody seeing my share? And then where's my? I want to show.
What are you trying to show?
This.
Yeah, ask what they.
Okay. Can people see this now?
Yep, this is it.
Yes.
Perfect. You got it.
Okay. Actually got it for me.
Yeah.
Okay, wonderful. All right, everyone. Oh, I just lost it, Akshay.
And also ask him to, that means change your background as well. It's pretty easy.
Akshay, come here a sec.
You can do that later, Nate. The background doesn't matter so much.
Okay,
The
no
fan
worries.
looks nice.
That's fine.
The fan
Change
looks
my
nice.
background. But can you guys see me as well?
Yes.
Yes.
Okay, they want to make this background. So this is fine. All right, everyone. Good evening, everyone. So everyone knows we all know each other. So I'm Naina Mehta. I'm a neurodevelopmental pediatrician. And I'm going to talk today about sleep and sleep disorders.
Devendra, you also see my screen as well, or
yeah, I see your screen. I don't know why.
Oh.
But can people see me or no?
We can see both of you.
You can see both me and Surabhai,
Yeah. His
Oh,
screen. Yeah.
and also my talk.
Yeah.
So let me
Okay.
just make you a spotlight, and then I
Okay,
should
there you go.
go.
Now I
Yeah.
see
Yeah.
myself. Yeah.
Oh, but then why you are on are you using a two things, or one is I mean, it's a tablet?
I'm just using my iPad. I don't have a laptop here right now.
Okay, so I don't know. There is something happened, and I have to check why there are the two screens, right, of your one.
Oh, there's two screens for me.
Yep. One, it is exactly where you are sliding it. So I just need to see how I can change that one up. If I do, what
It's okay. It
happens?
doesn't hurt the presentation.
It doesn't
So
hurt. Okay, then
keep
not
going.
an
Yeah.
issue.
All right, shall I begin?
Yep.
All right.
Yeah.
All right. Good evening, everyone.
Good evening.
And today, as I said, I'm going to be talking about sleep and sleep disorders. This is actually the first talk, the beginning of the talks that we're going to be doing on medical conditions. And from now on, every week, we're going to be having a different medical condition. I'm starting it off with the sleep disorders. So, what is sleep? So sleep is a stage of reduced mental and physical activity in which consciousness is altered and certain sensory activity is inhibited. There's also an alteration in brain waves, so it can be diagnosed by EEG. Now, everybody obviously knows that we all need to sleep, and everybody knows what it feels like when you don't get enough sleep. So I'll give you a bit of statistics. We spend a third of our lives asleep, and that's an average of 3,000 hours of sleep per year. On average, adult will sleep 7 to 8 hours. But most people don't get enough sleep, and 1/3 of adults report insomnia, which is the most common sleep disorder that I'm going to be talking about. The effects of, I just lost everything, sorry. The effects of sleep deprivation. I'm sorry, are we losing the screen? All right. The effects of sleep deprivation are it can cause problems with your health, problems with your mood, concentration, memory, emotional problems, and emotional stability. So it's really important that we all get enough sleep. So there are two types of sleep on medical terms. One, and you probably have heard of these terms, one is called non-rapid eye movement, which is non-REM sleep, or rapid eye movement, which is REM sleep. And it's just referring to how your eyes are moving in their socket with your eyes closed. So when you're in very deep sleep, in the deep sleep phase, which is the non-rapid eye movement, the eye is still moving inside the socket, but it's very little. So you're not able to visibly see it if somebody's studying sleep. It's very slow eye movements. You've got reduced sensory processing, your heart rate's low, your breathing rate is slow, and you even lower your blood pressure. Then you have the rapid eye movement sleep, which is when you're seeing a high level of eye movement, your heart rate's up, your breathing rate's up, and it actually accounts for about 20% of your total amount of sleep that you're getting at night, usually. And it's this is the time when you're getting your vivid dreams. So when we talk about both of those types of sleep, we have to talk about them in stages. So we have 4 stages of sleep in when you're going to sleep, and that these 4 stages cycle. So the very first stage is stage 1, which is the lightest stage of the non-rapid eye movement sleep. It's actually when you're just getting when you're just falling asleep, and at that point in time, you can be easily woken up. You haven't quite gone to sleep. Your sleep can easily get disrupted if there's noise or if anything happens or the light goes on. And you do see some alpha wave changes. So we do know that we're beginning to go into sleep. In stage 2 is the stage 2 of the non-rapid eye movement sleep. That's when brain and heart rate slows down and the sleep spindles start beginning. And stage 3 is just a deeper part of that same sleep. And we start seeing the delta waves. And the stage 3 is the most important sleep for us. And it's very important because it's restorative. And that's actually the stage that we really want to get to every night when we fall asleep. And it's also the time when you get parasomnias, and I'll talk about that a little bit later. So it's when you're actually getting different abnormal movements in the sleep. Stage 4, when you get to the final stage, is the rapid eye movement sleep, and that's the dreaming stage, as I told you. And it's also the stage when you can get arousals. And arousals are when you're woken up from your sleep by certain things, like when you have a hard time with breathing, like with sleep apnea. Sometimes even if the light goes on or something happens, you wake, but it's a time when you're quite confused. If you are woken up in your stage 4. And then when you get back into stage 1 again, then you've had your complete sleep cycle. So here you can see what I'm talking about with the sleep cycle. If you see at the top, there's the awake, which is when you're still awake. Then you go into stage 1, which is the non-rapid eye movement. Stage 2, when you're getting a bit deeper, and stage 3, when you're very deep. And then you go into stage 4, which is the rapid eye movement, and you're having your vivid dreams. And then you go back into the awake stage, and you cycle this every 90 to 120 minutes. So that's unusual when you think about it, that you're waking up every 2 hours at night. But actually, the awake time that you see, it's not a fully awake. So you're usually, and you don't even remember that you awoke. When you wake up in the morning, you don't even remember that you were awake for that period of time at night before you went back into the next cycle. It's usually when you wake up, you're looking in your room and everything is exactly how you are, and you fall back to sleep again. But it's the time when, if things have changed, and especially in children, like if you've put the child to bed in one place and then you carry them and you bring them into their bed, this is the time they'll wake up again and cry, because when they've woken up, they're in a different place and everything is unusual. And then you go into wide awake. And that would happen to us too. If we woke up and we weren't in our same room, we would be in a complete awake state and alert. But normally you would just cycle through these every 90 to 120 minutes. And so you have 4 or 5 sleep cycles every night. As I was talking about before, deep sleep is the most important sleep that we want to get, because it's the actual time when you have a release of human growth hormone. You're restoration of the body and muscles from the stresses of the day. It's restorative for your immune system, and the brain refreshes itself for a new learning. So it's really important that we go through those cycles and get to the deep sleep, which is the stage 3. So now I'm going to be talking about the sleep disorders. But before I talk about each individual sleep disorder, I want to just talk about the signs of sleep disorders. So a sleep disorder is when you're consistently failing to get enough sleep, or what we call restful sleep, constantly feeling tired when you wake up, or sometimes waking up even with a headache. You're chronically tired during the day and sometimes even sleepy during the day. You struggle to stay awake while driving or doing something passive like watching TV. Children will have difficulty concentrating at school, adults at work. Slow or unusual delayed response to stimuli or events. Difficulty remembering things or controlling emotions. Frequent urge to nap during the day, or snoring or ceasing to breathe during the sleep. That's actually what is one of the signs of the sleep disorders. So a lot of these things, I think many of you may also have experienced at some point in time, and we all, most of problem have experienced it. It sounds a little bit like what I'm going through as well sometimes. So when we talk about actual sleep disorders, there are two categories. One is called dysomnias, and one is called parasomnias. And you remember I spoke about the parasomnias into stage 3 of sleep. So dysomnias are actually just when you're having a difficult time, you're not getting enough sleep. So the number of hours of sleep is reduced, either because you're having a difficult time falling asleep, you're either getting early morning awakenings, or you just don't feel rested when you wake up in the morning. Parasomnias, on the other hand, are actually when you're getting abnormal behaviors and physiological events in your sleep. And those things are like nightmares, sleepwalking, or sleep talking. So we're going to talk about each one of the conditions. And if we talk about actual sleep disorders, dividing them into the dysomnias and parasomnias, you can see in dysomnias, we have the primary insomnia, which is what I told you that 1/3 of the adults have problems with. There's narcolepsy, sleep apnea, circadian rhythm disorders, and restless leg syndrome. And in parasomnias, you have nightmares, sleep terrors, and sleepwalking, which another name for that is somnambulism.
Naina auntie,
Yes.
would PTSD fall in like parasomnias with like the nightmares?
So PTSD is actually a condition in itself. And
Okay.
if nightmares is a symptom of that, then
Yeah.
the nightmare falls in the parasomnias, but PTSD doesn't know.
Okay.
PTSD
Okay.
is a
Thank you.
condition of itself, but in PTSD, you do have sleep disorders many times.
Okay. Thank you.
You're welcome. And any other questions, please feel free to ask, just like Puri did while I'm talking. And if I need to slow down, let me know that I need to slow down, because I sometimes do speak too fast. So we're going to talk about each one of these sleep disorders just in a little bit, not too much detail, because these talks aren't supposed to be so informative, but just so that you know about what we're talking about. And then when we talk about the meditative and the yoga approaches, you know what conditions they're talking about in helping. So the first one is primary insomnia, which is the difficulty either initiating sleep, maintaining sleep, or not having restful sleep. And you have to have it for 3 to 4 nights a week for at least a month for it to become a condition, which we would diagnose. It says primary because it's not related to any other medical or psychiatric problems, because a lot of the time medical conditions can give you less sleep, and if you're like having any pain from your medical conditions or things like that, then you're also having problems with sleep. That's a different, or if you're taking any medications by mouth that are having a side effect of sleep, then that's different. That doesn't come under the classification of primary insomnia. That would be secondary. As I said, it's one of the most common sleep disorders. 1/3 of the general population report these symptoms, and women report it 2 times as often as men. So what are the contributing factors to this? So as I said, the factors that contribute to having problems with sleep are pain, discomfort, or respiratory problems, high body temperature, like if you have a fever, or if you're taking sleeping pills and you've stopped them, you have rebound insomnia. So that can cause insomnia, but we've classified it under primary insomnia, but actually when it's due to another condition, we call it a secondary insomnia. Behavior and lifestyle, if you've been very inactive during the day and you really are maybe have been sleeping during the day, then you're not going to be able to sleep at night. So then you'll have problems sleeping. If you have bad routine, a sleep routine, poor bedtime habits or sleep hygiene, as we call it, a lot of that is if you're on the screen or you're on your phone just before bed, or you're watching TV just before bed, or any of those kinds of things which are activating your brain cells, give it a more hard time for you to fall asleep. And then if you have any psychological disorders like stress or unrealistic expectations regarding sleep, sometimes people think they have to sleep 10 hours a day of the night. And as you get older, as we know, our sleep hours do decrease. And so then you feel like you can't sleep because you've gone to bed really early, and it's just not that much time that you have to sleep. So does anybody have any questions about primary insomnia before I move on to the next condition? I'm going to be talking about the management of all the conditions in tomorrow. So we're doing this as the medical conditions, the first talk, and then the management of the medical conditions in the second day. And then after that, the following days, we'll be talking about the meditative ways we can do it, and any asanas which will help. All right, so the next thing that was on the list was narcolepsy. So narcolepsy is when you're having excessive daytime sleepiness. And it's actually irresistible attacks of complete refreshing sleep which occur daily. So it's not just like if you are falling asleep every now and then. It's actually when you're at your work or you're sitting up, you're doing your work, and then you suddenly just fall asleep. That's what narcolepsy is. And you have a sudden loss of muscle tone, and which is associated with intense emotion. So I forgot to mention that when you actually go into your deep sleep of the rapid eye movement sleep, you actually get complete paralysis of your muscles. So that when you're having the vivid dreams or having dreams, you're not actually, and in there you're actually moving, your whole body is not actually moving in its sleep. So when this happens in the daytime, you actually get what we call cataplexy. So your sudden loss of muscle tone. So you actually get like muscle paralysis. And it's called sleep paralysis. You can't inability to move or sleep or speak. And this actually happens also just as you're falling asleep or waking up. And at that time, you're unable to move. You can have hallucinations. They are hypnagogic or hypnopompic. So hypnagogic, these are both really interesting. Hypnagogic are vivid dreamlike experiences which you have as you're falling asleep, and hypnopompic are as you're awakening. And so many normal people can get that. So you sometimes have that feeling when you're falling asleep, and all of a sudden, just as you're falling asleep, you sort of have a feeling of hallucinations. And then it happens in the rapid eye movement stage of sleep, but it's happening in wakefulness. So when you're actually awake, when you're supposed to be awake, like the daytime. So that's actually a condition which has to be treated because it's obviously disturbs your normal daily functioning if you're going to complete deep sleep whilst you're awake and should be doing your work. Anybody have any question about narcolepsy? Hopefully nobody has narcolepsy. Okay, so the next one is breathing related sleep disorders, and that's most commonly known as sleep apnea. It's when sleep is disturbed by a breathing condition, and most often it's you can start by having some snoring, or you sometimes do have snoring at that time, but not always. But when you have your sleep study, they will pick that up on there, and you have conditions where you actually will have moments when you stop breathing. So the breathing's interrupted during sleep. And this actually produces numerous brief arousals during the night. So when you do get this, you're waking up several times in the nighttime because you stop breathing, and that gives very disrupted sleep. And during the daytime, you'll be excessively sleepy. The sleep apnea, the symptoms are loud snoring, daytime sleepiness and fatigue. You can often wake up with headaches in the morning. At the nighttime, you might have the experience of gasping or choking at night. And in the daytime, you have difficulty concentrating. So the sleep apnea can be either obstructive or central. So obstructive sleep apnea is when you have actual physical blockage of your airway. And the most common thing that blocks the airway are large tonsils or adenoids. Most often you have large tonsils and adenoids as children, but sometimes even adults have a lot of that tissue at the back of their throat, and they sometimes have to undergo surgery and remove it. And interestingly, my son just had that surgery, which is why I'm here in St. Louis looking after him. It's not a very pleasant surgery as an adult. It can also be that your palate is very, at the back of your throat is very lax, and so it's constantly flopping down and causing obstruction of the airway. And if the picture, you can see where you're breathing in from your nose at the back, it goes down into the trachea and then down into your lungs, and that airway can be blocked by a floppy palate, and then also by those tonsils or other obstruction. The other kind of apnea they have is a central apnea, which is actually the central part of your brain, which fails to signal muscles to breathe, and that's when you stop sleeping. That's actually much more difficult to treat than the obstructive sleep apnea. Other contributing factors which can lead to obstructive sleep apnea is excessive weight, being obese. If you have a very wide neck circumference, it's affected in men more than women. And there's often a family history, and it can happen if you use a lot of sedatives or alcohol use. So when you do have, if anybody has sleep apnea, it's really important not to drink alcohol and lose weight. So it affects an estimated 1 billion people globally, and that's about 30% of our adult population. And a lot of people are undiagnosed and don't even know that they have it. And you can become an adult and maybe have had it through childhood, but not even picked it up until adulthood or even later. Okay, any questions about sleep apnea? All right. So moving on to circadian rhythm disorders. And this we all will commonly know about, like if you travel a lot and when you say what we call jet lag, or if you are doing night shifts. So it's an inability to synchronize your regular circadian sleep-wake pattern with the sleep-wake schedule of the surrounding environment. And so that's when you start getting disrupted sleep. Either you can't go to sleep, which is insomnia, or you have excessive sleepiness during the daytime. So jet lag, the sleep problems caused by rapidly crossing multiple time zones, like when you're flying in the plane across the continents, or shift work type, and this sleep problem is associated with night shift work, frequently changing shift work. So many times when you're changing from night shift to day shift and back to night shift, that's going to cause a lot of disruption in your sleep and in your circadian rhythm. Any questions? Okay, moving on to restless leg syndrome. So now we're moving on to, so all these initial ones until now were dysomnias. They were just causing a difference in your sleep pattern. Now we're going to be talking about parasomnias, where we're actually having different actual abnormal movements. So the first one of those is called restless leg syndrome. And if for those of you who haven't heard about restless leg syndrome, it's when you have an irresistible urge to move the legs. and you have an uncomfortable sensation in the legs. It gets relieved if you move the leg, or if you get up and start walking or stretching. But when you're in bed and you're trying to fall asleep, you get this funny feeling of sensation in your legs. Beginning or worsens during periods of rest or inactivity. That means when you're lying or sleeping, and it's worse in the evening or at night. And actually may only occur then. And it's actually a condition that people come to the doctors with, complaining about, that they're having these. Sometimes they will just describe it as pain in their legs. And it's actually discomfort. It's a uncomfortable feeling in the legs, so much so that you can't keep them still, which is why it's called restless leg syndrome. Any questions about restless leg syndrome? Okay. So one thing about parasomnias, disturbance in arousal and sleep stage that intrudes the sleep process can be either in the REM or non-REM sleep. So I just wanted to mention that. It's not just in the REM sleep that you get the parasomnias. You can also have some in the non-REM sleep. So nightmares, which are the vivid dreams that we get, occur in the REM sleep. That's the very deep sleep. That's when you're having the rapid eye movements. So you have the deep REM sleep, and then the stage 4 is the REM sleep, which is when you're getting the nightmares. And these are extremely frightening dreams that interrupt sleep and interfere with daily functioning. So these are vivid dreams that you're actually remembering when you wake up in the morning, or even if you wake up in the middle of the night with them. You readily awaken from the dream. You have detailed recall about the dream, but it's not something that you can become rapidly orientated and alert. So when you wake up, you're totally awake. It's common in children, up to 50%, and much less common in adults, 5 to 10%. Sleep terrors is another parasomnia, which is also much more common in children. And it occurs in non-REM sleep. So this actually is in the non-rapid eye movement sleep. And they have, when the child wakes up in the middle of the night, screaming, intense fear, panicky scream, heart racing, rapid breathing, and sweating. And they abruptly awake from their sleep. They're not responsive to anything around them, unlike the nightmares where you're alert and orientated when you wake up. When you wake up in sleep terrors from that very deep sleep, you're not responsive to your surroundings. You're not responding to other people comforting you, or you don't even recognize that somebody's around you. And you won't even remember the episode afterwards. When somebody tells you that you were doing that, you're not remembering that either. You don't have any detail of that, any recall of that time. It's very common in children, it's not very common, sorry, just about 5% of children, but it's even less common in adults. Then lastly, sleepwalking, somnambulism. This also occurs in the non-REM sleep. So once again, you're in your deep sleep of stage 3, and you're not having any recollection of having done that. You get up from your bed and actually walk about. You have a blank staring face. So if you're seeing somebody doing sleepwalking, if you put your hands in front of their eyes or you try to disrupt them, they're not going to be responsive to you. They cannot communicate with others at that time, and you can only awaken them with very much difficulty. And when you do that, if you do wake them up when they're sleepwalking, there is a short period of confusion or disorientation. And once again, they do not recall what they did in that time of sleepwalking. And this is mostly a childhood problem, 15 to 30%, and most people outgrow it by the age of 15. But when you are doing that, it's caused more commonly when you have fatigue, or you haven't had enough sleep, or if you're using any hypnotic drugs, sedatives, or even it can be a little bit familial. that you'll find it in the family, that there's a history of it, of sleepwalking. And sometimes you get the story of the sleepwalking. They will do all sorts of things. Sometimes even go into the kitchen and they might even start cooking. So it's doing odd things. Sometimes it's behaviors that are very out of the ordinary that happen at that time. All right. So that's the end of my talk. Does anybody have any questions? I'm going to go stop the screen sharing. Oops. Yeah. Have I stopped screen sharing?
Yeah.
Okay, perfect.
I have a question, Naina.
Okay, who's this?
Does this Rakesh?
Oh, Rakesh, but yes, please go ahead. I'm trying to get the whole screen of all the people. Okay, anyway, go ahead.
So does everybody go through those 4 stages of sleep every night, or is that variable?
So it says actually everybody goes through those 4 stages, but it is variable, and it is, if I recall correctly, as you get older, you will sometimes go straight into you sometimes don't do the whole cycle for 90 to 120 minutes. It's much quicker, the cycles, or shorter cycles happen, and you require much less of that deep sleep as you get older.
I see.
And as you're a child, it's the opposite. You are having them as a longer. You're more at the 120 end of going through those cycles.
So the 3rd stage.
No, of going through the cycles, 120 minutes. I'm sorry. You're talking about each cycle.
Yeah.
Stage
Has
1,
4
stage 2,
stages.
stage 3, stage
Right.
4.
Right.
You cycle, that whole cycle is either
everybody's
anywhere between 90 to 120 minutes. Everybody goes through them.
Okay.
Anywhere between 90 to 120 minutes, but it can be as short as 60 minutes.
Okay.
And as you get older, the elderly, they have a much shorter sleep cycle. And when you're younger, you're doing the much longer sleep cycle.
Okay.
But not everybody necessarily has vivid dreams in stage 4. You're not, so that doesn't always happen. You will have that rapid eye movement. So if you were observing somebody, you were awake and you're observing somebody in their sleep the whole time, you will see them going through those cycles.
I see.
And if you're say watching your child or watching a child sleep, you'll see them going through. Babies have a lot of that rapid eye movement sleep. They cycle through the sleep cycles.
I see.
And spend longer in that stage 4 of the sleep rather than the stage 1, 2, and 3.
Okay. All right. Thank you.
Any other questions? Okay. If there are no other questions, what's the time? 7:41. Yeah, that's perfect timing. We can move on to meditation, and today Rakesh Bhai is going to lead us in meditation. So Rakesh Bhai, if you could begin that would be wonderful. Thank you very much, everyone.
Thank you.
Thank you very much, Naina. It was really a great session. Thank you very, very much.
I hope it was informative and not too informative, that it's too confusing. I was trying to keep it simple. Maybe too many medical terms, but it's difficult to give a medical talk without medical terms.
Thank you.
All right. And now we're going to go into meditation, not sleep, with Rakesh Bhai.
That's right.
I'm about to go to sleep.
Yeah, ready to sleep after the talk.
Okay. As Naina Ben indicated, we'll practice body perception meditation today, or Sharir Preksha Dhyan. In Sharir Preksha, or body perception, there are mainly two stages. The first stage, which is a shorter stage, 5 to 7 minutes, we'll go through Kyotsurg, relaxation mainly. We will relax our body one part at a time. And then when we have relaxed our body, we will go into deeper perception of body. So we'll start with choosing a posture. Let's take a comfortable posture, either Sukhasana, Padmasana, or Padmasana. Assume position of our hands either in Gyan Mudra, the index finger and thumb, the tips of the thumb and index finger touching, and on the knees, palms facing upwards. Or we can assume Vitrag Mudra or Brahma Mudra, left hand, right hand over our left hand, facing upwards, placed in our laps. Let's take 30 seconds to a minute. Relax. And now we will begin by focusing on the big toe of our right leg. Focus your attention on the big toe and suggest it to relax. We'll move our attention to the other toes of the right foot and suggest them to relax. Move over to the sole of the right foot, the heel, upper part of the foot, ankles, calf muscles, the knee, the thigh muscles, and the hip joint. Feel that the whole right leg is now relaxed. Now we will move over to the left leg. Again, let's focus on the big toe and suggest it to relax. Suggest the other toes to relax. Let's concentrate on the sole, the heel, the upper part of the foot, ankles, calf muscles, knee, thigh muscles, and the hip joint. Suggest all parts of the left leg to relax. Feel that both legs are now fully relaxed. Now we'll move over to the middle part of the body. Concentrate on the abdominal area. Visualize all the internal organs, the large intestine, small intestine, liver, kidneys, spleen. Relax all internal organs to relax. And we will move over to the chest area, the rib cage, or lungs, heart, all the muscles. Suggest them to relax. Next, let's focus on the neck area, the vocal cord, muscles, back of the neck, and shoulders. Suggest them to relax. Let's focus on our right arm, starting with the fingers, the thumb, and all the fingers. The palm area, suggest them to relax. Moving over to the wrist, lower arm, elbow, upper arm muscles. Suggest and feel that the whole right arm is now relaxed. Similarly, we will relax our left arm, again starting with the thumb and the fingers. The palm area, the wrist, lower arm muscles, elbow, upper arm muscles, suggest all these muscles to relax. We'll move over to the head area. All the muscles of the face, cheeks, lips, inside the mouth, temples, ears, muscles of the forehead. Relax. All the head muscles, let them relax. Feel no tension in any part of your body. Feel that your whole body has become light and fully relaxed. Now we'll move into stage 2, which is Sharir Preksha, or perception of the body. We will go deep into our body muscles part by part, visualizing not only the surface area, but deep inside, the muscles, the nerves, the veins, and the bones. And try to perceive, just observe without any liking or disliking. Observe what is happening in each part of our body. We will begin with the big toe on the right foot. Feel the vibrations inside the big toe. Concentrate. Focus your attention on the other toes of the right foot. Again, going inside, all the tissues the sole of the foot, the upper part of the foot, going inside the skin, penetrating the skin, the heel and the ankle. Observe the vibrations occurring in these parts. The calf muscles, if there is any pain in any part of the leg, let's focus there and try to visualize where that pain is coming from. If there is any tension, any stress, let's focus. Similarly, the knee and the upper thigh muscles. And the whole right leg. Visualize each and every tissue in the right leg. Just perceive. Now we will move over to the left leg. Again, starting from the big toe, go deep inside, penetrating the skin, visualizing the tissues inside the big toe, feeling the vibrations occurring there. The tingling sensation, feel that it is alive. Similarly, see the life in the other toes. The sole of the foot and the upper part of the foot. The heel, ankle, and the lower calf muscles. Visualize each and every tissue deeply. Feel the vibrations and the sensations in these parts of the body. Move over to the knee area and the upper thigh muscles. Again, identifying any areas of any tension in any part of the leg. Now we will move over to the middle part of the body, starting with the abdominal area. Again, focus on the stomach area, the navel, going deep inside, visualizing all the organs. And the vibrations occurring in each part of the abdominal area. Let's visualize each organ. The large intestine, the small intestine, the liver, kidneys, spleen, the duodenum, the stomach, and the diaphragm. Just observe each of these areas without any like or dislike. Try to feel the vibrations and the sensations, what's happening in our body. See that each of these organs are functioning normally. Similarly, we will move over to the chest area and see deep inside our lungs, our heart. Try to see the vibrations and the sensations in these tissues and organs. Try to visualize the blood flow. Bringing our attention to the shoulder and the neck area. Try to look through the muscles in these areas. Go inside and perceive each and every tissue. Now over to the right arm, starting with the thumb and the fingers, going inside the skin. Feel the vibrations. The palm area, the wrist, lower arm muscles, elbow, and the upper arm muscles. Let's take a moment to see what's happening inside. Now over to the left arm. We'll start with the thumb and the fingers. Feel the life in these parts. The palm area, the wrist, lower arm muscles, the elbow, and the upper arm muscles. See deep inside. It's like scanning our body, part by part. Let's focus on our back, the back muscles, and the spine. Visualize each part of our back muscles and the spinal cord. Perceive if there is any pain in any part, in any muscle. Let's focus on that area and see where that pain or stress is coming from. Now we will focus on our neck muscles, the throat, the vocal cord. See deep inside. Let's keep our concentration. Be aware. And visualize the facial muscles, the fine muscles of the face, cheeks, muscles of the lips, inside the mouth, our tongue, jaw muscles, teeth, back of the mouth. Just perceive without any judgment, liking or disliking. We'll move over the temple area, side of our face. Muscles, ears, outer ear, middle ear, and the inner ear. Let's take a moment to perceive the ears. Now the forehead. Let's penetrate inside our head area. Visualize the brain, all the brain muscles. Feel the vibrations, all the electrical sensations occurring inside our brain. Now we will perceive the whole body as a whole. For this, we will stand up. Let's stand up and scan our body from feet to head and head to feet. Slowly going up from feet to the head and going down from head to the toes. Feel that your breathing has gone down, slowed down to a bare minimum. This is a fully relaxed state. Now we will conclude our meditation by rubbing our hands and placing them over our eyes. Open your eyes slowly. Rub your palms against your face and relax. That's it, Naina Ben. Thank you.
That was wonderful, Rakeshji. Thank you so much, Jai Janendran.
Thank you.
Okay, excellent. Samiji has not been able to join today, so if anyone doesn't have any other questions, we'll end our session for tonight. And we'll see you all tomorrow again at 8 o'clock when I'll be doing the medical management of sleep disorders.
Okay.
And then I suppose somebody will decide who's going to do meditation. But that was good.
Oh, by the way,
Presentation.
just to let people know that while you're learning a lot about sleep and medication tomorrow, we're not going to test you on all of that, right? Don't worry about memorizing all these things. We'll let you know what you need to learn for the test. This is more when you're training somebody, you're aware enough that you're not going to stop the therapy, respect the therapy, understand what the therapy is for, what the physician may be trying to do for the patient, sort of thing. So when you do something, you're complementary and you can add to that. So it's to give you that bandwidth. So we're not going to test you on minutiae, so don't worry, just learn. And then some basics will test you on so that you're familiar. Okay? So just enjoy, learn. There's a lot to learn. We've got a lot of talks like this, and I think you'll be very, very well taught and maybe earn some respect to healthcare and how far it's gone. You know, people research drugs, what they're treating. So I think there's a lot that's worth knowing and understanding and respecting so you can build on it rather than compete with it. That's the goal.